Hi everyone, a very warm welcome to a rather special episode today because another virus and another episode and we are back. Just imagine a village of Maharashtra called Chandipura lends its name to one of the most fatal, most dangerous viruses which is hosted by our country in most parts of the western part of India, including Gujarat, Maharashtra, Rajasthan, and such parts, right? The most underreported, the most fatal virus, and India is a home to it. Why are we talking about it today again? Because we have seen the recent 22 deaths of children in Gujarat related to the Chandipura virus. So, we are here to talk about each and everything related to this virus because every time there's a new outbreak, it also becomes a potential question and it also gives potential questions in all of our heads. How should we suspect it in our patients? Should we be worried? What is going to happen? Is it going to lead to the next pandemic? Are we prepared to face it? What is the nature of this virus? Everything we are going to talk about. Hi, guys. Very good evening. Very nice to see all of you here. This is a must know for your exams. This is a must know for your life. And like I said, another virus, another update. This is something which was long predicted by infectious disease specialists and microbiologists that the viruses are going to take over the population because of something called as climate change. So today when we are talking about Chandipura virus, I am going to tell you how climate change is why we are coming up with all of these different viruses and how WHO has been proposing for the past 1 decade something called as the One Health approach, which itself is a possible potential PSM as well as microbiology question, that what needs to change in the way that we look at these viruses in healthcare so that we can protect humanity and ourselves from all of this virus. So is Chandipura a new virus? Absolutely not. India has been a house, a home to this virus since the 1960s and it has been killing lots and lots of people. So much so that it has been constantly present in the Gujarat region since 2024. So since 2024 to 2026, there has been small little outbreaks happening all the time. This is one virus which is endemic. It is endemic to this particular region. Very important to understand. This is not a new virus. This has not come on an airplane. This has not come because of some African country or any place. This is our own homegrown virus, given the name based on a village in Maharashtra where the first outbreak was seen in the 1960s. Okay, the Chandipura village of Maharashtra. The funny thing is that this virus is a close cousin of the rabies virus. And that is why you will see that the pediatric population is 100% a vulnerable demographic. Up till now, the only people who've been killed by this virus are children. So why does it kill only specifically children? Why does it only happen in this belt of the country? Why have we not been able to build any vaccine, any antiviral against it? What is it doing looking like the rabies virus? And what does climate change have to do with the spread of this virus? All of these questions are going to get answered in this particular video. So stay tuned because we're going to answer all the queries over here, right? So this, like I said, is endemic in this part of the country. It is always present, also involves Madhya Pradesh, so much so that in 2024, there was a very big outbreak which led to 81 deaths. And 61 of those deaths were clustered in Gujarat itself, okay? The rest were in the other neighboring parts. There is a 50% lethality of 50% death associated. So it's almost 30 to 75% is the death rate or mortality associated with this. Up till now, 148 total lab confirmed cases have been found. And just now, very recently, we had 22 deaths of children in Gujarat related to this virus. Now, what is it doing looking like rabies virus? It belongs to the same family, which is the Rhabdoviridae family as the rabies virus. Okay, so we know that the rabies virus or the Rhabdoviridae family is bullet-shaped viruses. Okay, they look like bullets. So does this guy. And a very beautiful way to remember everything about this virus is just remember silver colored bullets lying around in sand. So what does that tell me? That tells me that it's a bullet shaped virus. Silver stands for Chandi, so it's the Chandipura virus, and the main vector for its transmission is the sandfly. It's a sandfly transmitted virus. There is a bad news and there is a good news, and I will come on to both the bad news and the good news very, very soon. Just now, for now, we just need to understand that taxonomically, when we start from the order up till the species, we realize that the rhabdoviridae, the rabies virus, is a close cousin, and you know that rabies virus affects the central nervous system. So does Chandipura virus. Rabies virus moves very, very fast up the nervous system. So does this virus. Rabies virus loves it when it has to travel a short neuronal distance, such as in the children, and so does this virus. That is why we see the encephalitis syndrome with Chandipura virus. That is why we see that the death happens very, very quickly. I mean, at breakfast, the child will have fever. By dinner time, he will have seizures. And by the next tomorrow morning, there's a 50% chance that the child will die. So that is how fast this virus moves, right? Similarly, how fast the rabies virus moves. So they are close cousins. They move very fast up the central nervous system. They mainly target the central nervous system. And that is why the pediatric population is very susceptible, because they have small bodies and they have small distances. So when the virus enters, it has to cross a very small distance to reach the brain as compared to adults. Also, immunity also has a role to play in it, which I will be talking about in just a minute. So this is everything that it has same as the rabies virus. The difference is, of course, in the mode of transmission, because rabies is got by the dog bite and Chandipura is got by the bite of the sand flea. And sand flea, mind you, is something which is so small that it is smaller than a mosquito. A sandfly is even smaller or tinier than a mosquito, so you can even barely see it anywhere, right? Then you have, like I said, is the evolutionary cousin. It is called as the vesiculovirus Chandipura, or the Chandipura vesiculovirus. That is the full name. So in short, we write Chandipura vesiculovirus, or CHPV. Having understood the taxonomy, let's look at the morphology. Exactly the same as the rabies virus. The same bullet-shaped structure, the same single-stranded RNA, the same helical nucleocapsid symmetry, the same matrix proteins, the same glycoproteins on top, the same enveloped structure. Exactly the same as the rabies virus. So what do we understand? Which is the major important protein of it? It is the matrix protein, because against this matrix protein is what the neutralizing antibodies are made inside the people. And that is the great differentiating factor, because in most adults who live in the endemic areas, they are able to develop neutralizing antibodies against this matrix protein. But the children, on the other hand, are not able to build that immunity up till such a time. That is the reason, also one of the reasons why children get most affected by this virus. So if we have to devise any antiviral or any vaccine, these are the important structures that we will target. We will target the glycoprotein which is present, we will target the matrix protein, and we will target the nucleoprotein which are present. Similarly, just the same way in which we create the rabies vaccines, in the same manner, the vaccines for Chandipura can also be created because of the similar morphology. Now, to answer the big question, how has climate change attributed to the outbreaks and spread of this virus? Because the catalyst for it is the untimely rains and the monsoon seasons. So, especially in the rural areas where they have mud houses, which is a beautiful heritage, currency of especially the regions of Gujarat and Rajasthan, where they have these beautiful traditional mud houses. The problem is that these mud houses have little cracks in them, and in those little cracks, the sand flies can nicely live, lay eggs, give birth to their progeny, and spread the disease. And come monsoon season, the moisture and humidity increases by a lot, and usually people in the traditional monsoon period are prepared. But when the monsoon starts to come in an untimely manner, when the climate change starts happening and causes a havoc in the nature, there has always been noted that the number of these insects increases by a lot. So if there's going to be untimely monsoon and these sandflies are going to find the beautiful temperature to survive, they're going to multiply like anything, leading to these outbreak-like situations. So the catalyst is always the monsoon and the mud walls with the cracks in them. There the sandfly, which is the primary vector, is going to come and spread the virus. Now, you have all learned two important species of sandfly up till now. which is phlebotomus argentypus, and leukemia for leishmania. Now comes another sandfly. Please make a note of it. Put it in your diaries. It is phlebotomus phlebotomus and sargentomia. So it's not leukemia, it is sargentomia. So phlebotomus papacy and sargentomia are the two important phlebotomus or sandfly species which cause spread this virus. Now, is it only through sandfly? That is the bad news. No, it can also get transmitted through ticks, through mosquitoes, but at a very small rate. So the main vector that we must be careful against is the sandfly. That is why right in the beginning I told the mnemonic, just remember silver bullets lying in sand. So it's Chandipura bullet-shaped virus spread by the sandfly. All right. Transmission is zoonotic. So mostly the virus is happy going between a sandfly and animals and back to sandfly and then animals. So this is the rotation which keeps happening in the jungles, in the environment. As usual, humans like to interfere everywhere. Same applies to the urbanization and the climate change and the deforestation, right? Humans entered their habitat, and humans, the sandflies, they started biting the humans. Now, human is also a dead end host for this virus. So that is another question which you are going to get from this. Chandipura, dead end host is human. So human is not the definitive host. Human is the dead end host or the accidental host of these species. So just like you see in Japanese encephalitis, human is the dead end host. Similarly, in the Chandipura acute encephalitic syndrome, human is the dead end host. And the good news here is that no human to human spread has been noted in none of the strains. So that is a very, very good news. So the only way to get Chandipura virus is that you need to get bitten by a sandfly. So it kind of works like dengue. The only problem is that it is very, very fatal and highly, highly dangerous, because then the virus then behaves like the rabies virus and affects the CNS. So while dengue is not such a deadly virus, similarly, dengue no human to human transmission. Dengue spread by vector. Dengue endemic to the areas where it is endemic. Dengue spreads in monsoon season. All the similarities match with the Chandipura virus. The only difference is vector is sandfly, and it is a very deadly and a very fast moving disease. All right. So this is the life cycle. This is the way in which the virus moves. Then how does it spread inside our body? So of course, the sandfly is going to bring the virus in its proboscis, and it is going to make that virus settle under our skin. So this is where the virus is sitting under the skin. From the skin or the dermis, it is going to go to the bloodstream. Once it is in the bloodstream, it crosses the blood-brain barrier and it reaches the central nervous system. So it spreads very, very fast through the blood to the brain, and within 24 to 48 hours, it can lead to death. That is the whole big problem. Okay, that is the whole big problem, because whenever it infects the neurons, it causes microglial activation, which leads to immense inflammation. So what is this leading to? It is leading to a cytokine storm, and this cytokine storm is happening in your brains, and that is the problem. Okay, the cytokine storm happens in the brains, and over there, because of this extreme inflammation, suddenly there is cerebral swelling or brain edema, which is the cause of death and which is the problem. So that is what you have to notice, and that is what you have to take care in these patients, right? That your patient should not undergo this neurological collapse, which is going to happen within 12 to 24 hours. So very, very short window. It gives you a very small window to act swiftly, to act rapidly, because the virus acts very fast. So of course, within 2 to 4 days of getting bitten by a sandfly, within 12 hours, you will have a high-grade fever, severe headache and vomiting. But there is a distinct lack of the prodromal sign and symptoms, which is a big problem. You get a fever, and before you realize that you have a fever, you start vomiting and you start throwing seizures. That is the problem. A very small window is there. Hardly leaves any time for us to act. And within those 24 hours, there is the neurological collapse with the seizures, altered sensorium, tonic-clonic seizures and brain inflammation. Finally, within 48 hours, there is rapid descent into coma, respiratory arrest and death. Even the people who survive, they face serious cognitive deficits. So there is permanent brain damage that happens. That is why it's a serious, dangerous, scary virus we should be scared of. All right, we should be scared of. Now, so the CHPV causes the acute encephalitis syndrome. Like I said, it causes AES, which is the acute encephalitis syndrome. RT-PCR is going to be the gold standard method of detection. Antibody and antigen detection is problematic because not many kits have been developed, and also antibody production is seen in most adults which live in that endemic zone. So seroconversion is seen in most adults, okay, who live in these endemic areas. So what are the endemic areas? I'm going to repeat. It is Gujarat, Rajasthan, Maharashtra and Madhya Pradesh, the western part of India. Okay, over there most adults you will find have built antibodies against it. That is why they don't get affected with this virus. IgM capture ELISA. Now this guy we keep reading for dengue and Japanese encephalitis, and Chandipura virus is a beautiful mixture of both Japanese encephalitis and dengue. Most of the ecological patterns are similar to dengue virus: monsoon season, vector transmission and endemicity. Most of the clinical features are similar to Japanese encephalitis: very fast moving encephalitis syndrome, high mortality rate, and human beings are the dead end host. It is very similar to both the viruses. Now, even for diagnosis, we use the IgM capture ELISA for both of these. So, we also use the IgM capture ELISA for Chandipura virus. However, like I said, antibody detection cannot be the mainstay because you have many positive people endemically present in those areas. So what is the mainstay of diagnosis? It remains RT-PCR and detecting the RNA of the virus, right? Then, of course, in the ICU, the supportive care and winning over the cytokine storm, which this virus causes, is the main thing that we have to do. So we have to control the seizures by giving appropriate drugs. We need to take down the intracranial pressure and airway stabilization. So this is all the ICU team's responsibility, wherein the mainstay of treatment is to control the inflammation in the brain, to reduce the intracranial pressure, to reduce the cerebral edema which happens along with. All right. Now, the problem is treatment. Yes, many trials are going on, but no antivirals have yet been approved, are not being used as of now. Okay? No antivirals. So there is a ribavirin. You know, ribavirin is used for respiratory syncytial virus, but it is only in vitro efficacy has been seen. Human trials, animal trials not done. Favipiravir, only preclinical models. Similarly, all of the others. So we have RNA therapies and your antivirals against the L protein, but none of them have been tested in humans or animals. They're all only showing in vitro efficacy. Same applies to vaccines. Nothing is out there, nothing has been developed. But if we want to develop what can be the possible modes of giving the vaccine, is similar to what we would, what modes we had adapted for your coronavirus. So it is, of course, the recombinant virus, in which we can put it under a viral vector vaccine. We can put it inside a viral vector and then inject in our bodies. We can simply take a whole virus, inactivate it, give it in the form of vaccine. We can take out the DNA or the RNA, pack it in a viral-like protein and then put it in the form of a vaccine. Okay, so these are the potential possible proposed models of building vaccines. However, no vaccine is there. There is no vaccine. Okay, now the problem is that the balance scale is balanced. Okay, the risk factors or even aggregating factors or preventive factors, nothing is bigger than the other. So yes, it has very low pandemic potential. That is a very good news. Having said that, there are very high regional threats which are possible. So repeated outbreaks can keep happening at times. So since 2024, it was endemic in Gujarat. Still in 2026, suddenly we saw a surge and suddenly we saw an outbreak. So the current thing which is going around is definitely an outbreak. It is not endemicity. It's not a spontaneous phenomenon. It's not a one-off instance. It's definitely a outbreak situation that we are dealing with. Okay, so why is it low pandemic risk, because there is absolute lack of human to human transmission, and there is total dependence on environmental factors. The virus has to find the correct environment, the correct monsoon, the correct sandfly, the correct human, because a human who is an adult who has antibodies, the virus is not able to affect them. So the virus really needs to find a small little child playing in the dark in the evening during monsoon without protective clothing. That is what is needed for the virus. So that's a very specific environmental requirement. That is why it will never lead to a pandemic, because pandemics will happen when human to human transmission can happen. However, the risk is so severe that if you don't control the sandflies and the vectors and you don't protect the children, then the age group which is affected is so vulnerable that is an equal problem. And that is why it is not a funny thing. This virus is not a joke. So to halt the transmission, we have the One Health approach or the One Health defense. So now WHO proposes that you cannot just simply look at the way the virus behaves with humans. You simply just cannot have, human related health schemes and benefits. You really have to start considering the entire earth as an organism inside whom we live. Okay. So in order to safeguard the humans, you have to save the forest, you have to save the animals, you have to study what all organisms are present in the forest and in the environment. You have to study the zoonotic diseases. Up till now, we would just ignore anything which affected the animals, thinking that, okay, it causes disease in animal, not in human. But you must pay attention to all of it. So this is the One Health for the whole planet, not just human health. Because obviously human health is getting affected if our forests are getting affected, if our animals are getting affected. So that is what we learned from this virus also. The first thing that we need to do is vector control. We control the sandflies. We change the way in which we are building buildings and housing and deforesting, and also some traditional practices need to be questioned, right? Then zoonotic surveillance has to be done. What are these mosquitoes and sandflies holding inside them? We need to do research and find out what are the possible viruses that they're carrying which can potentially become a cause of an outbreak in the future. So we really need to have predictive strategies where we can predict what viruses are going to come. Then environment and community, like I said, protecting the children, vector control, providing safety nets, full sleeve clothing. So many factors need to be accounted for. Okay, that is going to happen very, very soon, guys. We will let you know. So the CHPV survival equation is, of course, the virus plus the sandfly plus the monsoon plus the patient being a child leads to the acute neurological emergency, which has to be managed in the ICUs. High fatality rate. So we always draw this graph wherein we divide the graph into 4 quadrants. This is high transmissibility and this is high lethality. This year we have seen 2 viruses, hantavirus and Ebola virus, right? So hantavirus was very low transmissibility but very high mortality rate. So Ebola virus will fall somewhere in the first quadrant, right? Then hantavirus. Then your Ebola virus was high mortality as well as high transmissibility. So Ebola would reach somewhere here. So the R0 value was very high and also case fatality rate was very high. So this is the most dangerous quadrant out there, and this is where your Ebola was present and this is where your Hanta was present. So where is Chandipura going to be? Chandipura is also going to be here because there is a very high mortality but very less pandemic potential, very less threat for being a pandemic. Okay, so this is how we plot 3 viruses we have talked about this year, and I think we are going to keep talking about so many viruses because of the constantly changing ecology around us at all times. So that is what you needed to know about Chandipura virus. Every time I say Chandipura virus, remember rabies virus, remember Japanese encephalitis virus, remember dengue, and it's an amalgamation and mixture of all of them. Majorly affects the CNS, leads to acute encephalitis syndrome in children, spread by the sandfly, and currently the only protective mechanism is wearing protective clothing to protect against the bite of the phlebotomous sandfly. Thank you so much, guys, for attending. Any doubts, do let me know on my social media and I will Hopefully, not see you soon in another session of another virus, but probably we'll see you soon in another session on another virus because this is going to happen. Thank you so much, guys. Stay tuned. See you in class. Bye bye.